Hello, dear friends. This is Sofia Dorinskaya, President of the International Bureau for Human Rights in Mental Health and head of the Sofia Dorinskaya Center for Medical Information. Today, I will tell you about the safest nootropic remedy, which, unfortunately, has somehow been forgotten. It was thrown out, removed from sight. And to be honest, because of this, people, patients, and frankly, medicine as a whole have faced major problems. So let's look at the sequence of actions. How does it happen that, for example, children with intellectual problems are prescribed antipsychotics? The sequence that I discovered? A child comes in with various intellectual disabilities or with some school problems, and the doctor, out of, so to speak, a desire to help, and according to their own understanding, prescribes nootropics to this child. What side effect do we very often see with nootropics? It's aggression. We see this effect in children, and we see this effect in elderly people who are prescribed nootropics for various cerebral circulation disorders. And then, when aggression starts, the person is prescribed behavior correctors in the form of neuroleptics. I even had a video like that. A father went to an appointment with his son, who was later prescribed nootropic drugs, and the father started taking those nootropics himself. That video exists, find it. And the father suddenly discovered, while taking this substance along with his son, that he started developing aggression at the same time as his son, both the son and the father. The father told the doctor, "We're both taking this nootropic and experiencing aggression." The doctor just brushed it off. And what are we seeing now? People were basically being doused with neuroleptics, like cockroaches with dust. Here, even small children are already being given neuroleptics, elderly people are receiving neuroleptics, and people of working age are being put on neuroleptics just because of some mood problems. They are prescribed nootropics, and again, neuroleptics can be prescribed to them as correctors. But neuroleptics, you need to be absolutely clear about this. They are neurotropic poisons. They are legal drugs. And basically, our population is being handed these legal drugs while being told how they supposedly treat the brain. So today, let's remember a completely natural, absolutely safe, and fantastically effective natural nootropic. They can't be to blame, to be at fault for. They aren't at fault, Tom. Vitamin B3, or vitamin PP, nicotinic acid in the form of niacin. There is also another form, nicotinamide. This is vitamin B3, but without the flushing effect, meaning it doesn't work with peripheral blood vessels. Today, I will be talking about real niacin, about nicotinic acid, which causes flushing for a while. And actually, the effect of taking nicotinic acid is simply fantastic. Let's start with the fact that there is such a deficiency condition of vitamin B3, nicotinic acid, known as Pellagra. And unfortunately, nowadays, Pellagra has changed its clinical manifestations because what we read in all the textbooks from the beginning of the century or even the mid-1950s about how Pellagra manifested itself. Now, you most likely won't see this. Why? Because the composition of food has changed, the composition of water has changed, and the composition of the soil has changed. In terms of its elements, the composition of the soil. As I understand it, everything that grows on Earth now has a slightly different chemical composition than at the start of the century. There are a lot of medicines now, and if, for example, a person develops pellagra spots in the form of simple peeling around the eye sockets, they are prescribed a zinc ointment, and it goes away, and as if it was considered that we had cured everything. But in reality, this is a manifestation of vitamin B3 deficiency. Let's recall what the manifestations of vitamin B3 deficiency are. What is pellagra? Dermatitis, diarrhea, and dementia. We very often see dermatitis in children with autistic spectrum traits, or with autism already, or with intellectual disabilities. Almost all of them have gastrointestinal disorders. And of course, there are intellectual function disorders. So, dear neurologists, forgive me for the banality, but honestly, before you start using all those heavy artillery like nootropics with their side effects, Finibut, which drug addicts use by taking several pills to achieve that narcotic high. Yes, you prescribe it to children, so let's remember that we have vitamin B3 acid, and you just start prescribing it to the child. And believe me, the magic of change won't take long to appear. Just remember, please, that the minimum course, the absolute minimum described, is 3 months, yes. That's what's described. That means it needs to be prescribed for a long time, especially when we already see pronounced changes, like intellectual disability or signs of autism. So please, you prescribe from 50 to 100 milligrams. Yes, if starting the medication causes a strong rash, redness, and discomfort, that's fine. First, reduce the dose and keep it for 10 days. Then increase to 50 milligrams in the morning and during the day. This is an absolutely fantastic thing. It's a completely unique substance that is absolutely safe when used in regular doses of 50 to 100 milligrams. Orally, as they say, means by mouth. So, if we're talking about it, I'm not talking about injectable use right now, because all injectable uses of vitamins are medical procedures, and we're not discussing them here. Where else should nicotinic acid be used? Nicotinic acid has a completely natural anti-atherosclerotic effect. It lowers cholesterol levels in the bloodstream. I have an acquaintance who was diagnosed with hypercholesterolemia, and he was prescribed medication. I just know he had a problem and became dependent, so now he has to take them all the time. So, nicotinic acid is an absolutely natural substance that lowers cholesterol levels, and nicotinic acid must be included in all protocols and standards. I don't know, somehow. Clinical guidelines for cardiovascular system pathologies. It absolutely must be used for people with trophic ulcers and diabetes, because that's exactly the effect of working with the peripheral circulatory system. When substances finally reach the extremities, yes, these are the trophic ulcers that people with diabetes suffer from. They forgot about this too. Unfortunately, I haven't seen it either, and I don't see people being prescribed this now. So let's remember this. It is used for angina, for cerebral circulation disorders, and for obliterating endarteritis. Smokers who struggle with this, please nicotinic acid, to be continued. You can use it for facial nerve neuritis, for various intoxications, and for gastrointestinal diseases of any kind. So, again, if the dose is 50 millimolars, do you think it's too high for the current condition? Allow the person to split the tablet. I have a case where we split a 50 mg tablet into 4 parts, and the person is taking it. So, you are introducing the person, so to speak, into this nicotinic acid intake regimen. And please, I hope that this video, for those who didn't know, will basically give some guidance to read about it. Yes, those who forgot will remember. And let's stop this completely destructive practice. Prescribing nootropics and then antipsychotics to everyone and anyone. You have to understand that a child who is on antipsychotics, it's truly frightening, because that child is essentially sentenced to intellectual disability. No nervous system will develop under toxic influence, and what awaits that child is disability, severe disability, and early death. So why do this when Instead of all these different nootropic drugs, prescribe them nicotinic acid. The shortest duration of intake is 3 months. From my experience, a standard 50 ml dose of nicotinic acid can be taken for years. Dear middle-aged people, if you want to prevent dementia in your older and elderly years, start taking nicotinic acid. If you have migraines, if you have headaches from spasms of the brain's blood vessels, I have a video about this. Start taking nicotinic acid. Gradually adjust the dosage. Keep taking it, and your body will slowly regulate this system because nicotinic acid is an absolutely natural substance. It cannot cause harm. Well, common sense is always important. Of course, you can even get poisoned by water. If you eat 250 milliliters of salt at once, you can get poisoned by that too. So you shouldn't buy a box of nicotinic acid and eat it all at once. I'm talking about normal, sensible use of the substance. 50 to 100 mano per day. And here is my experience. My practice shows that elderly people start to feel better. And of course, our little clients. But that's just parents showering us with gratitude. Indeed, people say that their condition is changing. So here it is. Here's the core. Here's the root. My friends, please remember a substance called nicotinic acid. Please, if you are currently undergoing active treatment, have diabetes, or cardiovascular problems, tell your doctor about this. I don't think anyone will mind if you add nicotinic acid to your regimen, and gradually the situation will start to improve. Because nicotinic acid, like all vitamins and minerals, is food, it's nutrition. And when we help the body in terms of nutrients, we make certain accumulations and gradually adjust your systems. But all the changes, all the improvements that come from nutrients, what is their benefit? They are very reliable. I hope this video was helpful. I hope my colleagues, neurologists, pediatric neurologists, and child psychiatrists, who, I know, most of you truly have the goal of helping your patients, found this helpful. Before you start this pharmaceutical attack on a person, start treating people with nicotinic acid. Believe me, your reputation as a skilled doctor will precede you. This was Sofia Dorinskaya. All the best. Goodbye.